The Michiana Health Information Network, or MHIN, connects healthcare providers with a clinical data repository that includes results delivery and a fully integrated electronic health record. MHIN depends on the Metronet for the delivery of critical medical information to and from healthcare providers throughout the region, with no worries about speed or bandwidth.
I think MHIN and the Metronet has put us way ahead of the curve as far as other communities, not only this size, but major metropolitan areas and major academic areas.
Information from many sources, over 140, come to the exchange. We sort it, assemble it, and route it back out to physician practices, and right back in some cases to emergency departments for the care of the individual.
Pre-MHIN and the Metronet, if a patient was referred to a specialist, they would have to walk over to the radiology office, get their film, go to the laboratory, get their lab reports, package it all up, and then go to the specialist. Now, if that specialist is using MHIN and the Metronet, they can access those results online. It's very convenient for the patient to show up at the office and the specialists have their information.
MHIN helps me get the information, and the Metronet helps MHIN get the information to me when I need it. It's instantaneous. Last week I saw a patient who had been seen previously at Memorial Hospital, and they continued to have the same abdominal pain. Rather than having to repeat blood tests, CAT scans, and urine tests, I got on MHIN and saw that not only did the physician do a very thorough evaluation, they did a CAT scan, they did all the things that I was thinking of doing for this patient. But because they had been done already and they were all normal, I was able to provide reassurance to the patient and try to find out what other issues were going on that required them to come back to the emergency room.
What MHIN allows us to do is to have one interface feed to the centralized repository instead of having multiple interface feeds to the providers in town. And so it's very easy for me to have that one connection that I send everything through, and then everybody can connect to.
Through MHIN and the Metronet delivery system, the physician is able to access that patient information to make better treatment decisions.
Because it's medical information, you want that medical information available. The Metronet allows us to have redundant sides or redundant loops around the community to gain access to that information.
It can really never go down. So what that means for us is that for connecting to us, we're on all the time, 24/7. We never go down. It's completely reliable.
We are well ahead of the curve as far as moving patient information to physician offices and to hospitals.
Metronet Zing. More data, more speed, more possibilities. What's not to like? Take the next step.